Have you ever left class with hip or low back pain and thought, is this just part of dancing or is something more serious going on? Or maybe you've had a lingering ache for weeks or even months and you've just been living with it. In today's episode, I'm joined by Dr. Sebastian Gonzales, a licensed chiropractor specializing in sports injuries and rehabilitation. This conversation is based directly on questions submitted by you over on Instagram. And we're diving into one of the most common issues adult dancers deal with, hip and low back pain. Sebastian breaks down how the hips, pelvis, and low back work together, what different types of hip pain can feel like in day-to-day life, and why issues like piriformis tightness seem to be so common in adult dancers. We also talk through a few very specific pain points that came up repeatedly, like pinching and extensions, knee pain during turnout, and low back discomfort in arabesque, and how to know when something should be evaluated by a professional. Before we get started, a quick reminder. This episode is for educational purposes only and is not medical advice. It's not intended to diagnose or treat any injury, and it does not replace working with a qualified medical professional. If you're experiencing persistent pain or symptoms, please consult your doctor or a licensed provider. Ready? Let's get into it. Well, thank you, Sebastian, so much for being with us today. I'm so excited to have you and your expertise.
Yeah, thanks for having me. It's always fun.
I'm so excited to have you on to talk about this because hip, back, discomfort, pain, all the things is such a big struggle for adult dancers specifically. But I think it's something that is not always commonly understood. You know, if you're not coming from a background where you have taken anatomy or different types of classes like that, you're like, I feel things, but I don't really know what is going on. So I would love if we could start with what is the right way for dancers to understand how their hips, pelvis, and low back actually function together if you're someone maybe that doesn't have that background of really understanding those things.
What I would always like people to understand is there's a term called interplay. Like you really can't have a good functioning lower back without a good hip. You can't have a good low back without a good pelvic floor and so on. And even goes further down the leg and up the arm, and like really everything is kind of connected. Grandma wasn't wrong with what is it, the thigh bone's connected to the head bone. Like it is very close, but I think the further we get away from the actual area that's discomfort or tight on people, they kind of lose focus of that. But some good resources online are if you Google regional interdependence model, or if you look up joint by joint approach, usually it's that one's in regards to personal training or strength training. Either way, you'll find a lot of different articles about this, and it's concepts that have been around for quite a long time. But in a general terms, they say that the body is alternating joints with different purposes. And so if you imagine like starting with the hip actually has a lot of range of motion, and you can tell by its architecture. It's a ball and socket, so it moves a ton, but the shoulder does too. Like you kind of take these two parts, like upper and lower, like they're kind of the same, but not, right? And then so if you take the pelvis is kind of like the shoulder blade. And then the knee is kind of like the elbow and so on. So there's these sequences that tend to go along different parts of the body. And so they say some of them are intended to be generally more mobile. If we had like a sliding scale of mobile versus stable, a hip would be more towards the mobile side. And then if you look at like a lower back, it's generally more stable, although people can move quite a lot through it, especially dancers can. But then when you look at the upper back, like the mid back, they call it thoracic spine, it's more mobile. Just the architecture of the spinal segments in those areas of the thoracic spine have more movement potential, generally speaking, than the lumbar spine. So when someone's back hurts, a lot of times they'll start, well, what can I stretch to the low back? Well, probably nothing. Like you can probably stabilize it, but then you can also look back at, does their hip operate really well, or have they had this old hip injury that they never really resolved, or one hip is stiffer than the other, or they have arthritis in that one hip or impingement and so on. And the list goes on and on with the different diagnoses can be dealt with this way. One that may pique people's interest is knees. Knees are basically at the whim of the hip or the ankle. Like knees are almost always, unless trauma related, but knee pain is due to hip or ankle dysfunction. But
Mm.
also, how do you have a hip that works well if you don't have a core that works well? And so you kind of see this interplay between things here.
Yeah. Yeah, it's like all up the chain. And I think that's so helpful to realize because it's like knowledge is power, right? So if you're having knee pain and you're so fixated on, well, something must be wrong with my knee, and you're kind of asking the wrong questions and looking for solutions in the wrong places most of the time, it sounds like, unless it's trauma related. So I think that's so helpful, even just to conceptualize your body as
Mhm.
more interrelated parts versus independent pieces. So that's super helpful. So in talking about hip pain, how do you categorize, I guess, hip pain in dancers? Like, is there different buckets that discomfort or issues can fall into?
Yeah. Yeah. So there's I usually go with three buckets, although reasonably we can probably make four or even five. But to keep things simple, bucket one is inside the hip. And so if you consider what inside the hip entails, that's like your arthritis, your there's even things like infections in there. There's hip impingement. I would even put ligamentous problems within this category too, because there are ligaments around the joint of the hip. You can put dysplasia in this category as well. So there's something really not going well. I don't want to say wrong because things don't have to be perfect. But there's something really not going well in the hip joint itself. And these types of conditions generally have their own type of symptom like presentation. And then other areas that are around the hip. So first we had in the hip, now we have around the hip, which is going to be like your tendinopathies or tendinitises. You have your strains, your hip flexors, your TFLs, piriformis, hamstrings, etc. These are the things that could sustain injuries as well, but they also have their own presentation pattern. And the last one is called referred to hip. Back of the hip conditions, like your piriformis pain, your deep glute ones, when dancers pound on their hips, a lot of those ones are actually referred symptoms, and they're referred from parts of the lumbar spine. Something that may resonate better about referred pain is a heart attack. When people have a heart attack, yes, they can have chest pain, but they talk about their hand inside their face and they start sweating and things like that, right? So there's other symptoms that go along with that. In that case, that's an organ referring, but also joints can refer, nerves can refer, etc. Even things like trigger points or within muscular tissue can refer as well. So there's predictable pain patterns most of the time with a lot of these problems.
So how can the listeners discern what's happening in their own bodies, what pain might feel like in those categories in day-to-day life?
Yeah, so the first one inside the hip, normally people feel it directly in the crease of the hip. Like the leotard line type of area, like it's right in the front. There are like little exceptions to this rule, but if I were to just didn't know anything else about the person, they started talking about that area, I would start thinking about those types of problems. And then you can do a series of tests, physical exam tests to figure out if it's actually that or not. So a lot of our diagnostic abilities come down to history or signs, symptoms, things that make it better, things that make it worse. Let me go to bucket three before I go to bucket two.
Mhm.
Bucket three is the referred for the back ones. Most of the time, people who have this type of thing also have a history of lower back problems. Bucket two was going to be the muscles and tendons or so on. Usually, tendon issues come up more with a spike of activity. Imagine someone who hasn't danced in a very long time and then took 3 classes a day for 3 months and wondered why their hip is hurting. That's an exposure spike, and usually those things are more bucket two. But also bucket two, usually if there's a pop and disability immediately following, a lot of times that is bucket two as well, but it's a higher level. It's going to be a tear or something like that.
Yeah. Yeah, and I think what you just described is very common for adult dancers of the activity spike because that a lot of times what happens with adults is maybe they are coming back from dancing as a kid or they're discovering ballet for the first time and there's an excitement to get back to it and get back in it. And sometimes I think the enthusiasm goes a little bit faster than what the body can keep up with. I know that was definitely something that I did. And so, obviously, broadly speaking, are there things that you recommend for that type of
For the
discomfort, pain,
activity spike
injury?
runs.
Yeah.
Yeah. I mean, I think being you got to be realistic with your body too. I don't know if you or your listeners are familiar with Tom Brady football.
Hmm.
So, I think Tom Brady, great football player, but also like good work ethic and everything like that. And they created this whole thing. It was like TB 40, right? Tom's 40. How's he doing? How's he still playing, right? And if you look at Tom, like what he's doing during the week, he's doing stuff that all of us don't really do. He doesn't have a desk job. Like he's taking care of his body. He's eating well. He has, like he's working out. Like I play recreational baseball. I know for a fact if I play a tournament on like I've gotten hurt on almost every tournament that includes multiple games a day for multiple days. That is just what I expect and what I know. But I know that if I build up to it, like I have a good friend who he knows tournament season's coming and he says, I just do another day a week of jogging and throwing. And it really helps me out. He's about 60 years old and he figured this out years ago. So I think maybe what the adult dancers should do is if you do have something in mind, like you want to do, this is your goal is to dance 2 hours a day. Maybe build up into that a little bit and give your body a little bit of permission to adapt to the forces that you're going to be putting upon it. And strength training generally helps out to build your capacity as well.
Yeah, so like a gradual progression, because I know a big one for adult dancers would be something like doing a summer intensive, where maybe you are normally taking 1 or 2 classes a week that are an hour and a half, and then you go to a summer intensive and you're taking multiple hours of class a day, and that can be a really common time for adult dancers to get injured, probably like the equivalent of a baseball
Mhm.
tournament.
Yeah.
And so the suggestion is to try to not go from, 1 or 2 classes a week straight into a 1 week intensive, but to try to build in some gradual
Hmm.
load leading up to it. Have you been craving more time in the studio and more connection with other adult dancers? If so, I have great news for you. This episode is sponsored by Label Active, a dance and activewear brand inspired by the artistry, discipline, and presence of dancers, and the host of the 2026 Adult Ballet Retreat. 5 full days of ballet classes and social activities designed specifically for adult dancers, taking place in Seattle, Washington, June 21st through the 26th. I've personally attended retreats hosted by this team multiple times, and it's always an unforgettable experience. There's nothing like spending a week surrounded by other adult dancers, immersed in your shared love of ballet, in a space that's supportive and encouraging. And this whole week is thoughtfully built around adults: the pacing, the coaching, the environment. And there's 3 levels to choose from. So whether you're a beginner or have been dancing for years, this event is for you. I'm so excited to be attending again this year, and I would genuinely love to dance with you in person. Registration closes on April 15th, so if you're interested, don't wait. And because you're part of the after-class community, you can use code AFTERCLASS100 and get $100 off your registration. All the details and links to register are in the show notes. If you've been dreaming of a ballet experience that fills your cup, I cannot recommend this retreat enough. Hope to see you there. I'd love to talk about piriformis tightness. This was actually a specific question that a listener had asked, and I know it's really common. So maybe if you could even just start by explaining what it is for people that don't know, and the role that the piriformis plays in our bodies just generally.
Yeah, sure. So the piriformis is one of those muscles that is really willing to help, but really bad at taking over jobs for other musculature. Um, this that I'll kind of zoom out on it first, and I will come back into it. So there's groups of muscles called the tonic ones, and there's the phasic ones. You can look these up online. There's a whole big old list of them. Basically, from a energy standpoint, the tonic ones have more mitochondria. They have more endurance. The phasic ones have less. And so the smaller muscle groups, if you look on that list of tonic muscles, you'll see that they're all of the muscles that everybody always complains about: piriformis, upper trap,
Yeah.
hip flexor, etc. Like you keep the list goes on and on. The other part of the list is the ones where whenever people say, I need to get this strong, it's the same ones, the glute max, the quads, etc. Right? So the piriformis is really just trying to help out in a job. Its main role is actually centering the femoral head within the socket of the pelvis. It doesn't really produce movement, although if you isolate it in like space, yes, if you contracted it, it would produce movement. But its job is not really to do that. The bigger groups do that. So when those other groups aren't doing that, the piriformis will work extra to help. It has more energy to do so because it has more mitochondria, and it may feel like it's strained and overactive. So, yes, it's very common for people to have that. Um, I would probably say uh, the best route to take to solve it can be to decrease the tone of the tissue, which would be like your rolling, your massage, and so on. But then also make it not work so much. And that would be let the partners of it, which is the whole other list, to start working again. Usually doing glute max work is really helpful. In the strength training world, that would usually be like a deadlift or a single leg deadlift. And I can't tell you how many people's piriformis have felt so much better over the course of 2 weeks if they just take this approach. But if you keep stretching it, it will continue to get tight again.
Hmm. So for someone who maybe is having discomfort but hasn't been able to like put language to it, what does piriformis tightness manifest itself as? Like, where would someone be feeling that? What would it be feeling like?
Mhm.
For maybe someone who doesn't know that that's even what they're experiencing.
So if you put your hand on your hip like you're mad, it's going to be below that. But you know that bone that you sit on when you're sitting?
Yeah.
It's above that.
Okay.
And it's kind of in the region if you were, so I'm feeling back on me right now. Like if I were to put my wallet into my pants, it's kind of where the wallet sits.
Yeah. Okay.
Okay. Depends how much you sag your pants, but it's kind of around that area. But it's going to feel like a deep ache. Usually for a lot of people, it's painful um, to sit on most of the time. Stretching it can be painful, but it can be relieving as well. There's enough evidence to show that when it is tight too, it can create some leg pain as well because the sciatic nerve passes through it or under it on certain individuals, and create foot symptoms and so on. But to be fair, that could be coming from the back as well.
So we actually got a specific question about anterior pelvic tilt and if it's possible to quote unquote fix that. And so maybe we could even just dive into that a little bit and similar to piriformis, if maybe you could even explain what it is for someone who is unfamiliar with the terminology and
Uh,
then,
For anterior tilt.
yeah, and if it's fixable or
Sure.
something that you can treat.
So yeah, an anterior tilt is like if you look at kind of butt out presentation
Yeah.
that people do, it's probably the easiest way to describe it. Um, it's like they look like a duck,
Yeah.
right?
Allie calls it duck butt, which I
Yeah,
think is a perfect
duck butt
description.
works. It's hard to like give good terms to this area. It always just seems a little bit off-putting, but so a duck butt works perfectly fine. So that is an anterior tilt, and then there's neutral, and then there's posterior tilt, which is like absence of butt, you know, and then there's everywhere in between. It's a paradigm, right? There is no need to fix it, and I think that's a myth that's been floating around about. Well, I need to stop doing this because it's wrong. It's not wrong. It's this that your body doesn't tolerate it right now. Um, and you can actually expose it to time in a neutral or posterior tilt by doing different activities or by incorporating it into your weight training or your exercises and so on. The trouble is that standing activities like dance, running, sprinting, these are anterior tilt activities. Jiu-jitsu is a posterior tilt one, right? And so they're just different things. So it's time spent in the activity, and there's nothing that we can really do to stop you from anterior tilting, nor do we want to. Like if we have you jump or leap forward, your hip will extend, your pelvis will anterior tilt, and your low back will extend too. It all goes together. Okay. So I think rather than figuring out how to fix it or stop it, because you can't, nor do you want to, I think recognizing that there may be too much time in that position is probably the alternative. Let me separate these into two categories here. People who are in pain because of their anterior tilt, that is one thing.
Yeah.
We may want to reduce it quite a bit and give them posterior tilt exercises even. Um, but people who are not in pain and simply have an anterior tilt, when you look at them, I don't really care. Like that's
Yeah.
fine.
Yeah, for like day-to-day life. Yeah, because I think it's one of the hard things with ballet is trying to get into that neutral position, and depending on, what's natural for you. For some people, being in neutral is not that difficult, and for some people it takes a little bit more engagement. But what role is, like, if it is something that's causing you discomfort, is that something that you would work on core engagement, or what would be like a way to
Yeah.
help with discomfort?
So yeah, so there's a few ways to skin it. Like the first thing is like number one, in those buckets, we have to decide, is this something that's going to tolerate rehab? Some people, it's usually younger individuals, but they have a condition called pars fractures. Like they are a different protocol. You can't just you have to discontinue with your dance and so on, and like there's a timeline involved, and those are whole different things. Um, but for a lot of people, they are non-surgical cases. They're not big deal cases. It's
Yeah.
just uncomfortable. And in that scenario, we usually give some form of core exercise and leg weight training to help out with it. So in that case, part of the rehab protocol may be revolving around improving hip function, which may include glute max strength. It may include hip stretching. It may include things like Copenhagen's or adductor exercises. Even though that is the back we're talking about, these are things that would take workload off of the back. Now, if we were going off of a standard back protocol, some of the simplest things to do is called the McGill Big Three. It's been around for quite a while. They're a very simple protocol. It's bird dogs, side planks or side bridges, or progressions or regressions of both of them, and then something called the McGill modified curl up, which also can be used as like a plank.
Yeah.
But if we do the plank with an anterior tilt and it hurts the person, how does that help them? So there's got to be regressions of these things, and planking from the knees can do it. Or we have an exercise which you can look at our YouTube videos. They're called the hard planks, which is coached in more of a neutral or a posterior tilt based upon the case. Um, the weight training though, it's always best practice to have, once you have the core stability there, you need to challenge it. And something like a split squat or a goblet squat in a manner that doesn't bother the back is usually best practice. And it doesn't have to be super heavy, but you want to encourage the body to find a challenge.
I would love to continue even in the same vein and just go through more of the questions and issues that people brought up, and then maybe if for each one you could throw out what are some of the most common underlying causes of these things that people can kind of understand where to start. One of the big ones that came up was pinching in extensions. So whether that's to the front, to the side, to the back, most commonly I think it's usually to the side for dancers. So what is like a common underlying cause of that pinching feeling?
Yeah, this one's a good one actually. It's funny, extension in anatomy is not to the side. It's a funny thing with dance, but it's what is it, the developpe and the developpe alla seconde, and it's all the side stuff, right?
That's impressive.
Is the only one backwards is arabesque, or is there other?
Yeah, yeah. Arabesque is to the back, alla seconde is to the side, and
What is a rond de jambe?
a rond de jambe is when you're moving your leg in a circular way. So you'd either go front side back or back side front.
Okay,
So
so it does end
rond
up
de
in
jambe.
extension at some point.
Yes, yeah. And actually, I lied. You would also call an arabesque derriere would be another way that you would refer to an extension to the back.
I haven't heard that one
Yeah.
before, but okay, that's good. So yeah, so pinching and extension, we'll talk about mainly from the side. If everybody uses their arm right now and then puts their thumb down and then tried to move their arm up to the side, you'll notice how sticky that feels.
Mhm.
And then if you turn your thumb up,
Yeah.
see how much better that feels?
Mm-hmm.
And so imagine like a mountain on your thigh bone. And that mountain spins when you change, in this case, your thumb. So basically the parts of your foot. I think Allie has a really good come from in this. It's called the happy hip position. But it's basically a posterior pelvic tilt. And you have to externally rotate your leg, which is the same thing as what we're talking about here with the arm. And it all comes down to allowing your body's anatomy to move freely. But yeah, it's gonna feel pinchy if you don't let it externally rotate and posterior tilt. Now, should you be thinking of that when you're dancing? Probably not. Like there's other cues and like things to think about when you're doing it. But I think that is probably the most common thing, especially in the absence of any real pathology. Now, people who have pinching, even though they're doing it well, those ones can be hip impingement, but most of the time dancers won't have that. They can have a type called a pincer deformity, which the trouble is that like people who, like say you're a linebacker, you generally have stiffer hips. Like those people are built for contact. And then people who dance, who are generally pretty flexible, they get told they have hip dysplasia and they don't have a lot of pinch points because their hip anatomy is so open. So for that reason, a lot of them actually do have a lot of good hip range of motion. They're just limiting it with rotation. But some of those actually end up being poor glute facilitation. It's just that their hip anatomy, the ball socket isn't working super well in the hip because they don't have strength in the other parts.
Okay. So it can almost be twofold or one of two, depending on the specific person, where it could be lack of turnout, so needing to turn out more, and or also not having enough strength in the supporting area. So you're lifting it without that.
And I've seen some people have like referred from the back with this too. It's hard, like there is definitive ways of figuring this out, but it all comes down to the individual. But it's almost like if we said someone has no money, it could be because they spend too much, they don't make enough, they have a hole in their pocket. Like there's tons of reasons why. But I would say those two are pretty top of the list.
Yeah, and I think the turnout one is really helpful because that's something that even people could try at home, of like if you commonly feel that pinching when you're in extension, and if you think about, because I've experienced that where it's like it feels uncomfortable, and then if I push just for a little more rotation, you feel a little bit of a release. And so I think that's like an easy one that people could do to see if that gives relief.
And probably using the bar too, like probably being face up on a bar or even like a table, and you put your hands on it and you can push down on it firmly. What this does is it allows the front of the belly to activate. And if you think of the pelvis as not just being pulled on by the hip musculature below it or the hamstrings, it actually pulled on by the abdominal wall and part of the obliques and so on. And so if everyone puts their hands on the sides of their hips like they were mad, and they kind of dial forward and backwards, when you dial it forward into an anterior tilt, it's like your abdominal wall in the front is elongated. And so what you could do to help out with the happy hip position is you can try to challenge the anterior wall to make it shorten or stiffen up. It's like contracting your bicep. And so an easy way of doing that rather than flexing is to push down on something.
Okay. Yeah, that's super. I'm literally going to try that after this. I'm so curious to see how that feels. Thank you to Apollo Performance Wear for sponsoring this episode of the podcast. If you're an adult dancer, you know how important it is to take care of your body so you can keep showing up to class consistently. And that's why Apollo has been part of my routine for over 3 years. Their compression products are truly my most used support and recovery tools, both in and out of the studio. The magic is in Apollo's use of graduated compression, the same compression level used in medical recovery garments, to help increase blood flow, reduce swelling, and help reduce the risk of injury. Their products are podiatrist approved and designed to support dancers through class, recovery, and everyday life. My personal favorite is their Jewel socks. They fit perfectly both over and under point shoes and slippers, and provide targeted arch and ankle compression without covering your toes or restricting mobility. They come in multiple nude shades as well as ballet pink, so they blend seamlessly into your skin or tights without cutting your lines. I also love their K-Warmer full-length leg warmers, which provide compression through the entire leg and offer knee and ankle support, as well as that extra warmth we all love. For daily wear, I use the Performance Crew socks, which feel great inside your sneakers or your favorite house slippers, making it so easy to support your body's recovery after class. It's also Apollo's #1 bestseller, with over 1,700 reviews, so you know it works. You'll find me in Apollo socks during ballet class, point work, travel days, and running errands. For adult dancers focused on longevity and recovery, their products are truly a game changer. Head to apolloperformance.com and use code AFTERCLASS10 for 10% off your first pair until March 31st. The next one that people asked about was knee pain in positions that are turned out. So I'm pretty sure the person who asked specifically was asking about fifth position.
There are a few parts in this. The first one is rewind back, thinking about the regional interdependence model. We know that the knee, unless trauma-based, is generally not the knee's fault. It's somewhere else. And so it could be ankle, foot, which is kind of in the same complex here, or it could be hip. Hip is the most common. We know the hip is attached to the pelvis. The pelvis, a lot of dancers have anterior tilt. The anterior tilt limits range of motion of the hip. So if this turnout comes from the hip, how are you allowing it to if you're in anterior tilt? So it's hard to know what this person's status is at the moment, but I think first is the hip operating well. The other thing we could look down to as well is, are they compensating with their turnout in other locations? We know the knee does not tolerate a bunch of rotation. It doesn't tolerate a lot of lateral bend. If you take your finger, one of the finger joints is a really easy one with this. And so if you go up and down with, not your knuckle, but your, like this one here. And so it goes forward, backwards pretty good. But if you go side to side, it's like, I don't know.
Yeah.
And then if you rotate it, it's like, I got a little, but nothing compared to forward, backwards,
Yeah.
right? That's the knee. So if you're making that area twist more, at some point it may speak up to you. If you look down at the foot too, you look at the arch of the foot, the dropping of the arch type of thing. And so that is also a pretty good sign of more stress happening at the knee as well. So I would look at those two parts.
The last question, this one actually came up a lot, and it was the low back feeling of being stuck in your arabesque. So extension to the back, that feeling that you're wanting to be able to lift your leg higher, but you just can't get it past a certain range. And I know a lot of adults, they really work on their low back and back flexibility, trying to get that leg up, but there's just this point at which it's stuck, it's not going any further. So is there any underlying causes for that stuck feeling?
There can be causes. If this was a adult dancer, like let's just say somebody's in their 60s or 70s, they may have conditions of the lower back or that are limiting lumbar extension just because of its bony architecture. One of them is called stenosis, which is the most common one. Other slang terms that are thrown around are degenerative disc or arthritis, or they're all kind of one and the same, generally speaking. But if there is limitations of lumbar extension because of some of those reasons, that may not actually return. But let's just say this person had a normal low back x-ray and they just happen to have one. I wouldn't get one just for looking at this, but it looked pretty normal. Then yeah, it could just be stiffness there. It could be a lack of support or core support too. So there are ways that they can probably get some of it back, but or you can look at passive extension, we call it. So let's just say if we're laying on our stomach and we press our chest up into the air, like into a cobra position. That one kind of if you look at the person, you can see where all their bend comes from.
Yeah.
In that one, it's usually the low back. And if they're kind of stiff in that, I would assume it's probably going to be stiff in the arabesque too. Yeah. But if they're pretty mobile in that, but it's absent in the arabesque, this may be more of a stability issue.
So is that something, when you say stability, that could be addressed through strength training?
Yep, it could be. It could also be that the person, I don't know how many times the people are going in this position, but I never do an arabesque. So I would expect I would be bad at it. And so maybe exposing it to your body to an arabesque more may actually help. But kind of the thought with range of motion in certain areas is kind of the same throughout. If you have the range passively, meaning someone else does the range and your body doesn't do the range for you, That's more of a qualifier of like how does your joint operate? Like, does it have the range at all? If it doesn't have the range, you're probably not going to get it,
Yeah.
right? And then you have active range, which is always less than passive range. And active range is how far you can move it under your body's own power, which
Yeah.
in this case would be an arabesque. They don't always match each other. But they say that when people are lacking the ability to do a large amount of their passive range of motion actively, it may just be a conditioning issue.
Yeah, which I think that's really helpful because I know a lot of people are like, I can get a certain level of range, either whether they're sitting on the ground in side splits or whatever it is, doing Cobra. And so they're like, why can I not recreate that? And strength is, such a huge part of what you can actually achieve on your own. And sometimes I think it's not like, I was so surprised when I started doing more strength training, how much more flexibility opened up of my range of motion, and I think it's
Mhm.
because we tend to think of it as like, "Oh, I just need to stretch more, I just need to work on more stretching to get flexible," but a lot of times it is that strength component of, well, can you get it there, if someone's not helping you, lifting your leg or you're not using gravity.
It's also hard to do under, and this is be totally philosophical now at this point, but but it may pique someone's interest and thought. There's a concept of threat which can limit mobility as well, and so threat can be conscious or unconscious, and it's like, well, I think it may hurt or be not safe to do a full arabesque, so I'm just not going to. The other thing is the subconscious one, which is the best analogy I can think of is if I taught you how to walk really well, like you're the best walker, and I put you in a dark room and told you to walk the best you can, you'd probably shuffle your feet. Movements get smaller, it's really guarded, and it's not that you don't know how to do it or can't do it, it's that you have perceived threat.
Yeah, or even like I'm thinking of how a lot of times at home, if you're just like messing around, you can do something to a more extreme range. And then maybe you get in class where it is a little bit more pressure and, there's people around you and you're a little more nervous. And that can, in a lot of ways, kind of tighten you up. So
Yeah.
it's interesting to hear that that's like a real psychological thing. Cause it's actually something dancers joke about a lot of like, why can I do this so much better at home in my living room?
Yeah. I don't know if I'm sure stage, like getting on stage is like a whole different thing,
Oh,
being in a different state, being in an intensive.
yeah, it's like getting your nervous system to be more comfortable in other environments. In your professional opinion as a chiropractor, when should a dancer start thinking about seeking professional evaluation? Like, what is normal? Ballet is kind of uncomfortable versus, okay, I should probably be seeking professional help
Mhm.
for this pain.
That's a good one. So we're always supposed to say see somebody professionally, and I do think it's not a cop out. It really is. It makes life easier. But let me skin this a few different ways. I think it'll provide better context for the timelines of things. And I can vouch for this with many of the different injuries that I've had. The first about 10 days to 2 weeks of an injury, whether it be trauma related or just like a little ache and pain that came from being on point too long, then those generally, during that time period, usually there's more of an inflammatory process. It's the body's natural healing process. For a lot of people during that time, it's going to hurt anyways. Like we can give care to do, we can give tissue work, we can do whatever, but like it's gonna hurt a little bit. With my hamstring tear for the first 7 days, it kind of hurt, and then it got a lot better.
And so you're saying anything beyond like 2 weeks, if it's not starting to improve, that's when you're kind of moving in the direction of, okay, this is a chronic issue that needs treatment?
Well, the first phase is called the acute phase. So that's kind of that first 10 to 10 days to 14 days, etc. And that always sucks. It's like again, it's like burning your hand or cutting your arm. It's like there's literally healing still happening. The chronic phase they say is I haven't really heard a good definition recently, but I feel like the last time I looked, they called it chronic pain once it hit 6 months. In the middle, they call subacute.
Mm. Okay.
I think in subacute phases where people have the most potential for recovery in a lot of different ways. Number one is they're not in the acute phase anymore. So recovery and feeling better with the low-hanging fruit is actually very possible. So that's where we have our bread and butter. I love seeing subacute cases because you can actually perform just very minimal work with them. And then within a week, they're like, oh my gosh, I feel so much better.
Yeah.
Acute phase, you can't really have that. So the subacute phase early on, I think usually a couple months is usually a really good time.
Yeah.
Beyond a couple years, it does get a little bit harder, but it's not impossible. But in the beginning, yeah, expect it to suck a little bit. But as you know, if you're in a lot of pain, go see somebody.
Yeah, and that there's, like we were talking about earlier, there's a lot of hope, especially within that subacute period, that you could really address things and get better. And so I think dancers are habitually terrible at just letting themselves be in pain.
Yeah. Yeah, I was thinking about this a long time ago because I was talking to a dancer about pain associated to the activity of dance. And I said, so growing up, were you ever in pain dancing? They said, all the time. I said, that's so odd to me because so I grew up playing baseball and I can only think of one time where I ever really had any pain that I would call pain in that whole time playing from first grade till high school or college.
Yeah.
But this person said, I am always in pain dancing. That doesn't seem right to me.
Yeah, I mean, I don't think it is. I think it's just this really weird part
Yeah.
of the ballet culture specifically that it's like become normalized. But it is like for someone who that didn't grow up in that, you're like, what? You're in pain all the time? Like that's so crazy.
It's mind-boggling. I mean, maybe I don't understand the culture or I don't understand the need or demands of the sport as much as it could, but it's just mind-boggling to me. On a side note with this is my one of my associate doctors, she sees a lot of runners and um they have a lot of the similar problems associated to energy expenditure. And so she did a podcast on REDS. It's called Relative Energy Deficit in Sports. She did a podcast on our podcast about um, if you have a tendon injury that is not healing, it may be because of this. And it's not even a musculoskeletal disorder where you would improve it with soft tissue work, stretching, or strength training. You would actually just eat and possibly do things like look at blood work. Is there iron deficiency, et cetera? And so these people, the concern is what is not really that the people wouldn't get better. They could, and they can feel better. But the problem was the long-term effect of having energy deficits on the hormonal response, as well as bone density, et cetera. So how's a person going to fare over time if they're in REDS too long?
I was just talking to someone earlier even about how they were just feeling chronically fatigued in class and felt like even though they were going consistently and by all accounts should have been developing stamina, felt like they couldn't get past a certain point and went and talked to a nutritional therapist and it was an electrolyte deficiency. So yeah, there's just so many things that can contribute to these issues and that lead to injury and chronic pain. And when you're trying to figure out what's going on, exploring all avenues
Yeah.
is great because the answer might not be where you think it's going to be.
Yeah.
So how can people connect with you? Because I know you have a lot of resources on YouTube, even if like people that live in the Southern California area and maybe want to connect with you in person, how could they find you?
Our website is p2sportscare.com. So P, the letter, to the number, sports is plural, care.com. We also have a very extensive YouTube channel. I think we just crossed 200,000 followers. We release videos all the time. I think it's at Performance Place Chiropractor. Our podcast is actually now dead, but it's alive. But I'm not contributing to it anymore unless there was something really that I wanted to share. I know how much work it is to do a podcast. So, but if you look up the podcast, it's called Restoring Human Movement. But yeah, we're in California. We also do telehealth, and part of our practitioners are licensed in different states. So we do a lot of telehealth as well.
Okay, great. Yeah, I was going to ask that if people wanted to do even just a virtual session of like, here's what I'm feeling in my body, helping to diagnose, maybe do treatment, people can do that with you through telehealth.
Yeah, it's funny. I've had a lot of people over the years that they don't understand the value of a telehealth session, and maybe they've had a bad experience before, but like ever since COVID, it's actually we've done a ton of them. I'd say it's easily 25% of our client load. And it's for most people, it is very easy to make even diagnosis on there, have them do self-test. You use the history, rule in, rule out based upon does it make any sense. And then coaching of exercises on there is actually really easy too. So we see a ton of people with the telehealth, and it is very simple. But there have been some cases though where we can acknowledge in the very beginning we're like, this is not a telehealth case, and
Yeah,
so we just tell people at that point we think you should see someone in person.
this was so helpful and enlightening, and we covered so many topics. And I think everyone that submitted questions is going to be really excited because I think we addressed pretty much the full spectrum of hip questions that people asked. So I really appreciate your time. It was really fun talking to you.
Yeah, happy talking to you. Thanks for having me on.
Thank you so much for listening. If this episode was helpful or encouraging, I'd love for you to share it with a friend or leave a quick review. It's one of the best ways to help more adult dancers find this podcast and feel a little less alone in their ballet journey. All the links and resources mentioned today are waiting for you in the show notes. I'll meet you back here next week after class.